Okay, well, hello. Guys, I'm Dr. John at the Voyage Clinics. This is the Voyage Clinics podcast, and today I'm flying solo, and I'm just going to talk about some of the things that I've been dealing with lately. It seems like for the past 18 months, it's been the never-ending viral season. Usually we have a viral season that's 3 to 4 months. It's over the winter, but since the COVID stuff that we had, we've noticed some just a really constant stream of really bad viral illnesses coming into the office. I just had to hospitalize a kid yesterday. And so I just wanted to kind of talk about some of the pearls about viral illnesses. So I talk to people all the time. I manage this every single day. And so let's talk about some of the big players. Common colds. There are many, many common cold viruses. And they all cause a milieu of symptoms, like a bunch of different types of symptoms that are very common. And they don't always look the same. It could be the same virus, and three different family members can have totally different symptoms. And it can just affects people differently. The reason for that, one of the reasons, is because we all are a little bit genetically different, but also our immune systems maybe are just a little bit different as well. Maybe I have had more exposure to some of these viruses than one of my family members. So because I'm a doctor, I'm in a clinic, I see viruses every day. And so one of my family members might get really sick where I just had a snivel for 3 days. And so that's kind of the diversity there. What are those symptoms? So the typical viral syndrome, right? So you're going to get this virus. It has to be vectorized or spread from one source to another source. So coughing, aerosolized. Those are a lot of the respiratory viruses. You can get it from sharing drinks. You can get it from touching things and putting them in your mouth. And so you have to have that virus introduced into your usually nasal mucosa, oral mucosa, and then it starts to invade those cells. And then you start having sore throat, runny nose, because it's in your nasal mucosa, and then sometimes fever, chills, body aches for some of the more severe viruses, or a non-severe virus that you haven't seen in a long time. So we'll circle back on that. I've seen a whole bunch of that lately. So you can get a fever, sore throat, runny nose, body aches. So you can get achy body, achy legs and arms and back, and I always get it in my back and my neck. Muscle aches, so they call them myalgias and arthralgias, joint aches, very, very common. And so that's, and then you can also get eye involvement. So you can get conjunctivitis, so kind of a viral conjunctivitis. Adenovirus very, very commonly causes a conjunctivitis, runny nose, sore throat, fevers, all those things. Maybe not fevers, but just runny nose, sore throat, and then a goopy eye. And so very, very common. And so that can be involved. You can also involve the gut, so the alimentary canal from mouth to anus, and you can get diarrhea, you can get vomiting, and they can all be the same kind of common cold viruses. You can get a viral gastroenteritis where it just hits your gut and you throw up, you have diarrhea for a day or two, and then it's gone. And so that's like a viral gastroenteritis. You can get a viral upper respiratory tract infection, which is the runny nose and all that stuff. And so let's just talk a little bit about what to do. This is not medical advice directly to you. This is just kind of what we typically do. And talk to your doctor before seeking medical advice. Obviously, these kinds of things are really important. There's a lot of diversity in treating somebody, actually managing someone. There's a whole bunch of variables involved in that. So this is not intended to be medical advice for you. Please don't take it as such. Just know that these are just some pearls with regard to viruses. So you can do a lot of different things for viruses to help your symptoms. The typical virus runs its course in 5 to 7 days. Usually, sometimes less, sometimes 2 or 3 days if you've seen it before, sometimes 10 days, right? You've had a fever for like 5 days and you're still sick at 9, 10 days. That's going to be more like the influenzas out there. They're going to knock you down for a little bit longer. So 5 to 7 days, typical virus, worse symptoms for 3 days, and then better, 7 days, you're done. That's typical. Now, occasionally people will get what's called an opportunistic infection where they get worse, they get better, and then that sets up a nice petri dish of mucus. That mucus can pull in your sinuses, it can pull in your ears, It can pull in your lungs. Those are the three most common opportunistic infection areas in our bodies. And so those then can start growing some bacteria, right? So there's three more common bacteria that cause ear infections or sinus infections. And that's very, very common. So if you had a virus and it's been 10 days and you're not better and you have some pressure in your sinuses, go see your doctor, because you could have an opportunistic bacterial infection of your sinuses. If it's been 8, 9, 10 days and you had a virus and you're having ear pain, you might have an opportunistic bacterial infection. If it's been 2 days and you have runny nose, cough, sore throat, and you have an ear pressure, it's probably just viral. It's just the mucus pulled into your ear, and it's you can't hear very well out of it, and it hurts. And those we should not be using antibiotics for. So hang tight if it's only been 2 or 3 days. Kids are tricky in that situation because kids will get sick. They'll booger for a long time after they're sick. Then they'll get sick again. Then they'll booger for a while. And so it can be very, very smushy. Again, talk to your doctor, not medical advice. But if you have some of those symptoms, consider the time frame of them and consider if it's a kid or not. And then look into the possibility of an opportunistic infection with bacteria if it's been a while. The lung one is the same. So it's been 10 days, maybe 2 weeks since I was sick, and now I'm coughing more. I'm kind of short of breath. I can't breathe very well, and my mucus has changed, and I'm getting fevers at night. You might have a pneumonia, right? An opportunistic bacterial infection in your lungs. Go get checked out. So those are just some pearls for you. There are a couple, in order to avoid the petri dish that creates a lot of these opportunistic infections, right? The mucus that's sitting there, stagnant pond, it's in your sinuses, it's in your ears, in your lungs. In order to avoid that, there's a couple things we can do. So mucolytics, things that break up the mucus, right? So make it more like water, less like honey, so it drains. So it'll drain from your sinuses, it'll drain from your ears. That would be guaifenesin. It's the active ingredient in Mucinex. And so be careful with Mucinex because it has a whole bunch of combos in it that we sometimes don't need. So I'll just like to do generic guaifenesin and do the extended release one if you can. And that way you don't have to take it every 3 to 4 hours. And that will break up the mucus, make it more watery, so it drains easier. So that's super helpful. N-acetylcysteine, NAC, is also beneficial. It's a mucolytic as well. You can find it. It's over the counter. Both of those are over the counter. You don't need prescriptions for either of those. And so very common things that people use during colds are just guaifenesin and N-acetylcysteine. You can also do something that dries up the mucus production. So that would be along the lines of Sudafed, pseudoephedrine, and those are often in cough syrups and cough medicines. They're often behind the counter, so you have to ask the pharmacist for them. I think that's because people were using them to cook up meth and stuff, and so you have to ask pharmacists, "Hey, I'm not a meth cooker. I just have a cold," and they'll give that to you, no sweat. And so that one's nice because it dries up the production of the mucus and prevents that stagnant pond. I'll sometimes, say to one of my clients, I'll be like, "Hey, you should take these medicines." And they're like, "It didn't even help." And I'm like, "Oh, they're not supposed to make your cold go away. Your body is going to fight the infection and the cold's going to be gone in 7 to 10 days, but they're going to prevent that opportunistic bacterial infection in 10 days. So that's the key there, is just to use them for preventative purposes. That's great. Are there any like supplements that we can use for viruses? Yeah, there's some evidence behind some supplements: vitamin C, zinc, vitamin D. Make sure your vitamin D is up. Many people have a low vitamin D level, and that compromises your immune system a little bit. So make sure that's up. You can also use things like echinacea. There's some evidence behind that. And elderberry extract. I grew up in the mountains of Nevada, and we used to pick elderberries all the time. Got some fun stories about that. Some folks drink elderberry wine. I don't do any of that stuff, but elderberries are pretty cool. They actually create a heightened immune response to these viruses and have been shown to be helpful in fighting them. Word of warning with elderberry extract, because it heightens your immune system. I don't like for folks to use it with COVID. And so because COVID, in some people, spike protein of COVID can create this exaggerated immune response. And so they have this like cytokine storm. You guys may have heard about these things where they get this inflammation in their lungs and in their body, and it can cause like respiratory distress and all these things. And so we don't need extra heightened immune response with COVID. So avoid elderberry extract with COVID. That's like a little pearl for you. What else? Exercise. So what about when I'm sick? I'm so tired, I just want to lay around. Nothing wrong with that. Rest, sleep, do all those things, but don't slug on the couch all day. Get up, move around. Why? Because when you move around, your lymphatic system is mobilized. So it moves your white blood cells, your red blood cells, your immunity, it moves it around, and that's wonderful. And that's how we fight infection. So those white cells have to go to the areas and process the virus and the cells that are infected by the virus, and then get rid of them and do all their things. That brings me to a thought about immunity. So with regard to viral exposure, nothing wrong with viral exposure. People got a little bit germophobic during COVID. Germs are wonderful. They're actually super normal, and we should all have exposure to germs, viruses, all the germs. It's great. And we're meant to process that, actually. And in fact, the social distancing and isolation that happened during the COVID season is one of the reasons why we've had this 18 plus month of never ending cold and flu season, because we lost immunity during that time. Immunity comes in a couple of flavors. One of them is antibodies. So that's kind of a short-term immunity. The common cold, you might create active antibodies for 3 to 4 months, 5 months. Influenza can have antibodies against influenza for up to a year. So that's kind of cool. And so there's, a heightened immune response, but it does wane over time. That's the antibody immunity. Cellular immunity, which is your body processes these viruses and then create cells that then create immunity to that virus. That can last a lot longer. So that can be in the tune of like years. So a lot of people were checking antibodies as a measurement of immunity to maybe COVID or some other things, right? And while that is somewhat true, cellular immunity will continue much longer than antibody immunity. So that's a good thing to know. When antibody immunity wanes, it does predispose you to getting sick again. So common cold, for example, I got sick and then I got better. And then 5, 6, 7 months later, I got sick again. But this time I was just like 3 days. It wasn't a big deal. I just had a little tickle in my throat, coughed a little, had a little runny nose, and it was gone. So you still had that cellular immunity, and it ramped up really quickly and killed it off really quickly. So those are really cool things that our immune systems are able to do. What about kids? Kids have a ton of immune potential. While they're more naive with regard to everything, they're also immunologically naive as well. They haven't seen as many viruses as my body. And so they have this really active gland called the thymus gland, and it's producing a whole bunch of immunity to all the things that they're touching and sneezing and licking and putting fingers in each other's mouths and doing all kinds of stuff. And that's wonderful. And they're built for that. So they can process a whole bunch of different things all at once, which is why, you can do like they can crawl on the floor, and they've processed like 100 different viruses or bacterias and all the things that are in that, on that floor, and their immunity is just getting smarter and smarter. People that want to maybe like stagger the vaccinations and things like that, that's an argument against it, because you got a thymus gland that can process all those things like super easy. And so there's no reason to kind of stagger those out and stuff. That's just your thymus gland. Kids' thymus gland is very active and can process literally hundreds of different antigens like a day. Like that's probably not data driven, but we see it all the time. And so, so those are kind of the main things. What about when I have a cold? How do I prevent its spread? How do I not become the vector, right? A vector is a line between two people. Respiratory viruses, they vectorize through coughing, sneezing. So they're going to spread from me to you. I'm going to cough. It's going to aerosolize in the air. You're going to breathe it in. And so you got to be within proximity of that cough or sneeze, or, smooch or sharing drinks too. And so those are very, very common. If you have like, let's see, Epstein-Barr cytomegalovirus, these are going to be like the mononucleosis, mono diseases and things like that. Those are more just pharyngitis, right? So they're not necessarily respiratory. So those would be like the kissing disease, right? Mono, or sharing drinks, even more dramatic. So you can get it from either one of those. So there are viruses that are just pharyngitis or laryngitis, and then there are some that are more respiratory. And so the spreading of those are just different, the way that they're spread. What about a GI bug? Like if I got the nausea, vomit, diarrhea virus, that's going to be spread, kind of gross, fecal oral. So you didn't wash your hands good enough, and then you ate a chip. You get the point. It's a fecal oral spread. And so lots of different ways to get that. And it's kind of gross, but lots of people get GI bugs. It's super, super common. And so, yeah, those are kind of some of the more common viruses. What are their names? I mean, there's a bunch of them. There's parvovirus, adenovirus, Epstein-Barr virus, cytomegalovirus, and there's many, many coronaviruses. In fact, COVID is a type of coronavirus. There's a whole bunch out there, and there's all variants of all these viruses, and they're all spread all over the place. And it's okay. So don't be afraid of viruses. Viruses are perfectly fine. If you're immunocompromised or you have, some other things, then yeah, you should be conscientious about it. But again, I don't think fear really serves anybody with regard to anything. So one of the goals of this podcast is to create some understanding around viruses and how they work, and get rid of some of the fear. Fear drives cortisol. Cortisol is not good for our immune systems, and it can be hard to lose weight if your cortisol is high. It can be hard to really accomplish things and fight infection if your cortisol is too high. And so even during the COVID season, like I would do a house call and go see my patients and talk to them and put an arm around them. And they're like, "What do you mean I got COVID?" I'm like, "I know, it's okay. Like this is a virus, like it's okay." And so I think that just helped lower their cortisol levels and just kind of help them forward. And so I think those are all really important things to do.